In Guatemala, kids often don't have enough to eat. This weakens them and makes them susceptible to becoming sick, especially when they live in unsanitary conditions. Diarrhea and respiratory infection are the most common causes of the death of children in Latin America. These health problems are also easily and inexpensively treated. Gloria is little David's mother. She probably doesn't take any special notice of him as he plays with his brother Brian, who is sponsored by Danelle and Michelle of California. Brian has Down syndrome and receives sensory stimulation and language therapy twice a week at the Common Hope Project. Their playing together is a normal scene in Gloria's home. Just because David recovered from diarrhea a couple weeks ago doesn't seem like something to celebrate. But then it's hard to see what didn't happen. This could have been a different story, a tragic and unnecessarily sad story.
Pues David estuvo malo de la diarrea.
David was sick with diarrhea, and I think when I send him to school, he touches things and puts everything in his mouth. And so he got sick, and I took him to the project. The doctor cared for him and gave him proper medicine. He's now fine. He had to take medications for 5 days. Day by day, he was returning back to normal health.
Approximately 8,000 people who live in poverty have access to Common Hope's health facilities. The clinic is a place where worried mothers and fathers can bring their sick children. It is a place where problems are prevented and tragedies are averted. Common Hope helps parents to never know the pain that might have been, as life-threatening illnesses become forgotten memories.
La ayuda que clínica.
Amalia works in the clinic and understands. Amalia was a sponsored child herself and grew up in the same streets as the families she now serves.
Esto ha servido muchísimo en el desarrollo de las familias.
This has impacted the development of families in a positive way. And mainly, I think the biggest change is in people's health, because many times children will die because they didn't receive medical attention.
While curing illnesses is certainly important, it is even better to prevent them from occurring in the first place. It takes special vision to see the illnesses that never were.
What's really going to make a difference is changing the living situation that people have, helping them have clean water, a safe, clean living environment, enough food to eat so they're not malnourished, so they can fight off diseases, access to health care so that when they get a small illness, they can be treated quickly and then not develop into a larger thing that gets complicated and expensive to treat.
Así que ponemos el jabón.
Something as simple as hand washing can save a life.
Palangana, palangana, palangana. Aquí.
Lorena is an energetic volunteer from Chile who teaches parents and children how to live healthier lives. And yet there will always be illnesses. Some can be cured. Others, like diabetes, are chronic. But if it is managed, it can become merely an inconvenience instead of debilitating.
Every day we see a lot of people with complications from chronic diseases such as diabetes and heart disease and hypertension that could be prevented by medication. And because the medications are not easily available here, we could make a difference here in the clinic by providing those medications and the treatments that they wouldn't otherwise get.
Common Hope operates a fully stocked pharmacy. The online inventory allows the medicine to be purchased at cost from a friendly pharmacy in the United States and carried to Guatemala by volunteers. When watching a child play, it's difficult to see what didn't happen, what was prevented. Gloria may never know that a stranger living thousands of miles away made a donation that may have ransomed her child from tragic death. It cost $13.26 to help David.